Sometimes I'm like, fuck the research, because some things just literally can't be researched. And does that mean it's not accurate? No, it just means that you literally can't control this variable and have a whole randomized double-blind control study.
There's so many studies that haven't been done or that can't be done.
Literally can't.
Like we can't compare this drug versus eating a very clean, like healthy lifestyle. It's human nature to know that these foods are not good for us. And it's human nature to know that people should not be on 100 medications. It's human nature to know that we should eat fruits and vegetables, things that grow out of the soil, not that are like ultra processed. We don't need a shit ton of research to know that.
If there is research that shows this, like, for example, this pesticide causes more estrogen and endocrine disruptors and all of these things to our system, but there's not an actual evidence-based research that shows it on a human, we can connect the dots, Like, we don't need a study with people that had the pesticide and didn't to know that it's bad for us.
What's up, guys? Welcome to the Physio Diaries podcast. We are your co-hosts, Dr. Melanie Ziaziris
and Dr. Alice Gojavatsky, where students, healthcare professionals, and wellness junkies come to get the inside scoop of the healthcare and wellness industry.
The podcast you didn't know you needed, by your favorite travel physical therapist.
What's up, physio friends? Before we start getting spicy with today's topic, we want to ask you a small favor. And that is to please rate our podcast. We love that you are following and listening to us. And it would really mean a lot to help us just continue to grow our community if you gave us a review, and bonus points to those of you that want to leave a 5-star review. So let's get into it. The goal for today's episode is to talk about the American healthcare system, just base it off of our own personal experiences, some research that's out there, and just create conversations based off of what some other medical professionals out there are trying to say and trying to speak up. We are talking about Casey and Callie Means. They're a brother and sister, we believe, that went on the Joe Rogan podcast a couple weeks ago. I listened to this podcast. I told Mel, you have to listen to this because it just really echoed a lot of the things that we kind of say as physical therapists in this ever-evolving healthcare world. And I really liked the episode, and I know you really liked it too. So we're excited to kind of just talk about it and bring in personal experiences and just put it all together.
Keep the conversations going, because that is what is needed in this industry.
Yes, or else we're never going to get better.
This is perfect timing because everything always lines up. Like every time we do an episode, I feel like the week before leading up to it, there's always something going on that has to do with what we're about to talk about. And this week, I have felt so fed up with the healthcare industry, insurance, medical care, all of it, surgical care.
All of the above.
Oh my gosh, all of the above. And I just want to preface this by saying not one single person is at fault for any of this. I beef a lot with the medical doctors and community, but this is not catered to one specific person. And I'm not just trying to shame one type of doctor. It is the industry that is fucked. And I'm more hating on the industry and not the individual.
Yeah. But, it's no specific person's fault. It's like the systems that we have in place that is the way it is, like big pharma and just medical schools in general. If you look at who funds them, guess what? A lot of it is the pharmaceutical companies. The biggest research medical schools are all funded by, you guessed it, pharmaceutical companies. It's just that you have to kind of keep that in mind. And healthcare, really, like we all take an oath and we're like, we are putting the patient first. And sometimes it doesn't always feel like that in certain situations.
Does not always happen.
Yeah.
And like we said, it's not just one person, one thing. There's so many factors that are involved. And we need to fight the system.
Sometimes you feel really small as just like a, little PT that's trying to fight this, like, it seems like this big monster. But honestly, having these conversations, that's why it's so important to talk about these things, is because a lot of the things that they talked about in this episode that we're going to kind of discuss today. Not a lot of people know, and I learned so much just by listening to that podcast episode. And so we hope that you guys, really take something out of this too and spread the word. So I actually, had you known who Casey or ever heard of her before or her book before?
I have not. No.
Yeah, I had not either. I'd heard of her book before, but I didn't ever think to read it. I've listened to the entire audiobook.
Okay.
It's called Good Energy. So listen to the entire audiobook. It was really long, but honestly really good.
What do you listen on?
Spotify.
Oh,
so
it's on
with
Spotify?
Your Spotify, yes.
I
So
didn't know
with
that.
Spotify Premium, I think you get a certain amount of hours a month of like audiobooks. So I chose that one for the month and I finished it in like 2 days.
Oh my gosh. Don't hate me, but I'm an Apple person.
Wait, I didn't know that yet. Good thing you're on both
Spotify
platforms.
Premium. And I'm like, I don't even have Spotify Premium.
Oh my gosh, what? Wait, do you pay for Apple?
Yeah.
What? Yeah, no, that's like crazy. But I know that a majority of our listeners, actually, I was so surprised when I was looking at our statistics that more people listen on Apple than Spotify. I was like, what?
Yes, I know.
I don't understand that. That's crazy. But I'm glad that people like Apple. Honestly, I just got used to Spotify. I've been making playlists since 2013, 2012, every month since then with my favorite music, and I can't switch now.
That's how I feel about Apple. But anyway, besides the point.
Yeah, we will save that for the break room talks next week. So anyways, Casey is a medical doctor. She did finish medical school and she graduated from Stanford University, which is like an amazing program, an amazing school. I believe she was in residency for surgery, like upper head, neck, ENT stuff. It's one of the best residency programs in the country for that. And she was
supposedly. Right?
Yes. Yeah, it's supposedly a good point. The more that, it seemed like she was getting further into her residency and performing these like frequent surgeries, and she just felt like she was putting a Band-Aid to the actual problem. It's like, why are these things happening? Why are these patients having these like weird nose problems? And what's really the root cause of this? We're not getting at that. They are told to perform surgery. That is what they're taught to do.
Prescribe medications, like
prescribe medication.
Once you have whatever condition, disease, then you treat it.
And it's not being treated. And oftentimes, medications always have side effects and they can lead to further problems. And then medications interact with each other. So anyways, what she was saying was she noticed that she wasn't treating the root cause. Her patients were still sick. They're still needing medications. They're still needing surgeries. They're not living healthy lifestyles. And then she noticed that in the medical system, they really convince you that you need to specialize in something. You need to be highly specialized. So then you're starting to look at a patient from only one little perspective when you can't. A patient is a full human being, like all systems together working in conjunction with each other at the same time. The medical system really puts doctors in these small categories to focus on tiny little things. And that's where things go wrong too, because people are not communicating because this patient is a whole, not just a certain body system. So I believe she ended up dropping out of residency.
Yes, she did.
And she was like, heck to the no.
She said, fuck this.
She said, fuck this. And I can't imagine that, because that must have been so scary when your whole life, like she's probably 30 something. She'd been working towards this goal. And once she got there, it was not what she expected, which is insane to me. And that just makes me so grateful that I chose physical therapy, because I'm kind of the opposite. I didn't know too much about PT.
100%.
And the more I learn about it and the more I learn about the medical system, I'm like, I'm so happy that we're making a difference and we're addressing the root cause of people's problems and really helping them better their lives without medication and, injections and surgeries. Hopefully.
Yes.
So anyway, she ended up dropping out and started this amazing program that helps people really get to know the root cause of their problems and educates them about various aspects of their health. And she's just amazing and honestly like a role model to me now.
No, what you said about like choosing physical therapy, like for anyone who is listening to this and you're in like the healthcare and wellness industry, you can probably relate to what I'm going to say, or we pick everything for a reason, right? Certain things work out, other things don't. I wanted to go into healthcare and some form of medicine, but I knew I did not want to be a medical doctor. purely because I did not give a fuck about the pharmaceutical industry. And I was like, I want the holistic approach to things. And I don't even, like, it didn't even click with my brain. It was just like, I had this feeling inside that that's like what I wanted to do, but I really didn't know too much. Like, this was in high school. So like, how much can you really know as a high schooler, right? But like, I just had this feeling that I wanted this holistic approach and look to things. And it's just so funny how that stuff happens in a line. So interesting to me that her and her brother went to medical school, went through all of that, and then realized that it was fucked and that there's more to actually learn and see that will actually help people, and then left.
And I'm happy that she didn't step away completely from medicine. She figured out, because a lot of people, a lot of doctors, a lot of physical therapists, people leave the medical field because they feel like they can't do much about it. Yeah. And that is not true. But to a certain point, if you're that burnt out and you're so over it, you sometimes just need to step away. But what she did was she did pivot, but she still stayed and kind of like tried to fight what she did not like in the medical system. And now she has this clinic that brings people in and helps people educate people and focuses on diet and exercise, which is crazy to me because in medical school, sleep, everything in general, like as a whole, and it's crazy because medical schools, she was talking about, do not teach those kind of things. Like she said, most medical schools don't even offer a nutrition class.
Yes. They said, but in the podcast, they had said 80% of medical schools do not offer any nutritional courses. That's crazy.
Insane. Yeah,
like,
that's insane
what?
To me. And honestly, as PTs, I feel like we should have at least one nutrition class, which I did have one in undergrad, but I would have liked one in PT school.
Yeah, actually, you're right. I'm like trying to think back. Like, I don't know if because yeah, you're right. I minored in nutrition and I took a good amount of nutrition classes. So maybe I'm like thinking about that. And maybe we didn't really have any in PT
We did
school.
not. No, yeah, like honestly, there was no time, but there was the other classes that I think could have been cut short.
Added it for sure. Added it in.
Yep. And add that in. That's more important, Yeah. That would be one of my critiques, is definitely another nutrition class, because I talk to people about food all the time.
Literally all the time.
Yeah, all the time. And I would like more information on it, but I just do my own research,
Yes. Yeah. And that's the thing. Like, you have to literally go out of your way to learn these things. And as healthcare providers, for one, we're already fucking tired. We're already having to deal with all of these things, see patients every single day, treat all of these things. And we need time for ourselves. But then we also have to do more research and learn about things that will actually help our patients too. So it's just like, there's so many barriers.
Yeah.
And if we don't realize it on our own, how are we going to improve and get better?
Right. Exactly. Yeah, I honestly want to do a nutrition course as like a continuing ed because I was going to say that was a big, big topic in that episode where they talked a lot about diet and nutrition. I've heard patients tell me, the doctor told me I need to lose weight.
Oh my God, I literally have a perfect example of that.
Yes. And I'm like, okay, and what did they tell you? What resources did they give you?
Literally.
How are you supposed to do that? That doesn't make any sense. And also that's rude. Like, they should not be saying straight up, you need to lose weight. Like, no. Tell them why it's important. Give them the reason. Don't just be like, you're overweight, you need to be lighter, or whatever.
And like, what are your barriers? Oh my gosh. Okay. I have a rant. So patient story time.
Let's hear it.
Because this is a very classic example of shit we see very frequently. And that happens to so many people. So I had a patient that came in, a bunch of pain, bunch of surgeries, chronic pain, a bunch of other things, 100% metabolic dysfunction, obesity. Yeah, there's a bunch of things going on. And they were told by their medical doctor to lose weight, and that would help. And I said, okay, I don't disagree, but did they give you any information? Did they refer you to a nutritionist or dietitian? Did they try to talk about any medications they want you to take? Did they say literally fucking anything? And they said no. And all they said was just lose weight and nothing else. And it's just like, okay, if you just tell someone to do something, for one, without explaining why it's important, for two, talking about the barriers they have to even achieving this, if this medical doctor talked to this person, they would have learned that they are not sleeping. They have the worst diet that I've probably ever seen because they are running off adrenaline and fumes and stress. They are working full time, and then they're working 60 to 70 hours a week trying to survive. And obviously financials are a barrier. Like, there's literally so many areas that need to be discussed.
Well, also
that we should be talking
reminds me, in school we learned about like the motivational interviewing and like the aspects, the stages of change. So you telling someone to change, like you telling someone to lose weight, if they're not even in the contemplation phase, they haven't thought about it themselves, they are not going to ever change. They're not going to lose weight. They're in pre-contemplate. They haven't even like ever thought about it. And if somebody just tells you to lose weight, if you don't have any personal factors or any personal motivation, let alone the means to do it or the knowledge or the resources to even like know what to do, you're not going to do it. So telling someone to lose weight is useless without anything else. Literally useless. And I think it's also honestly really inappropriate if you just basically tell them, all right, you just need to lose 50 pounds. Like, do not say literally that. You have to be very cautious because that's also a very touchy subject. And I've had multiple patients be like, I was told to lose this and this weight or else I can't get the surgery, or I need to lose this weight because I have arthritis. I'm like, okay, well, what resources did they arm you with? Right?
Yes. And I'm sure so many of us have heard they just said exercise. Okay, but what type of fucking exercise? Did they give you any parameters? Did they talk more about what exercise is and how many times we should do it? The parameters, like, why we need to be like giving actual details to things, because if you're not going to give details, you might as well just not even say it.
Exactly.
And again, not shaming all medical doctors because there are some great ones, but this is some amazing system. Ones. This is the system that they're not learning.
I was just gonna say. Yeah, also part of the reason is they have 10 minutes with their patient.
Yes,
literally. They see 50 patients a day, minimum. Do you think they have time to have those conversations? No.
When we have
barely
an hour,
have the time.
Like 40 to an hour.
We are lucky, and that's why I love physical therapy so much, is because we get to spend so much time with our patients that we actually get to have these conversations. And that's part of the reason why I knew I didn't want to be a medical doctor, because I wanted to really connect well with my patient and see them on a regular basis and get to know their why. Like, why do they want to be able to get stronger? Is it to lift their grandkids? Is it to like be able to ride their bike again, or whatever it is? I just like to know them more on a personal level. Like, you know, we don't all have to be friends, but I just like to get to know them better and spend more time with them. And the doctors, it seems like everyone always tells me I only got to see them for 5, maybe 10 minutes. That's why it's like we can't even expect them to have these conversations, because they're expected to see, 50 people in a day and figure out what's going on with them. So it's like you said, it's the system. It is not the doctors. A lot of the people that go into medicine really, truly care. And I don't think they realize how the system is, like Casey, until they're actually in it. They're either in their residency or they're actually starting their first job, and they're like, wow, this is not what I expected whatsoever.
Yeah, totally. And I think the generational differences makes a huge difference too. Like, obviously your younger doctor, healthcare professional in your life is probably going to be a little bit more nuanced and whatnot, and knowledgeable of some other things compared to maybe some more traditional, more old school practitioners, I guess is a good way to say it.
Yes. That's interesting that you say that, because we have a really young, right now at our place, a really young, I think it's an orthopedic surgeon, and everybody raves about him.
Okay.
Everybody loves him, and he's super young. I looked him up because everybody just kept like, people just rave about a certain doctor. You're like, who is this person? Why is he so special? And I start to ask, and they just say that he sits down and takes his time and explains things. That's all, that he just explains things and feels like not a doctor, but somebody you can actually have a conversation with.
Totally.
You're not being told to do this and this and this. He's explaining why. And that makes a huge difference, and patients love it.
So much of a difference. I mean, if you think about it yourself, like if someone just told you, like, okay, your x-ray findings are this is bad, you have this, and this, you might need surgery, and that's it. Like, that's wild. Like,
yeah.
What? You're going to have so many questions. You're going to feel so defeated. You're going to feel so bad about yourself. You're not going to know what to do. You're going to just be like, okay, I need surgery. I need this, because what else is there to do?
Yeah. Yeah. What's always funny to me too, and I think we've talked about this in the past too, is like when a doctor tells a patient, okay, you're going to need this surgery. Okay, you're going to need this injection. Okay, you're going to be put on this medication. People don't ask why.
They literally don't even know what the fuck is going in them. I'm saying, is it a steroid shot or is it gel? What is it?
They don't know. But when I tell them to do a freaking squat, they ask me why they need to do a squat. I'm like, what?
How many reasons do I need to list?
Right. Like, it's just crazy to me that people are still like very, very trusting. And they should be to a certain extent. Not even trusting, but ask questions. Ask why you need this medication. Ask how it's going to affect. Ask the side effects. Like, it's crazy to me that people don't know about their health. But that's why it's important to educate patients that, they need to look into these things, and they need to be knowledgeable about their health.
I think also that is a generational thing too, because in the 1900s, early 2000s, the whole thing was like doctors know, like medical doctors know everything. Like, you don't question them. This is how it is. This is how things get treated. And so many people, I think, are still in that mindset and also don't question because of that. They just think, oh, this person is a doctor. They know best. And that's just not always the case. And there's just so many more complexities to the healthcare system that are generational, and there's so much history involved that I had no idea.
It's pretty wild. I was just going to say really quick that the more I learn about this topic, the more I'm happy that I tried the holistic approach and going to like a holistic practitioner. And I hope that one day it'll be a lot. Like we said, it's not even covered by insurance to go to a holistic practitioner. And that is so crazy to me that, I mean, it's not, but it is, that insurance doesn't cover it, but it's because it doesn't make money. But it's because
insurance.
Exactly. There is some, I mean, for literally millions of years, people have been using roots and plants and different things, herbs to use for treating different things, for wounds, for high blood pressure. There's so many different things. And a lot of these drugs that are being developed are based off a kind of similar composition to plants, things that already exist. And they're not going to make money off of that, right?
No, because they don't profit off of it, because they can't mass produce and give it to everyone.
And get people addicted. So it's just wild to me. And I really hope in our lifetime that insurance will cover visits to a holistic practitioner. And I don't know about that.
I know. It's like you can only hope.
You can only hope. But
But I learned this from Casey, and this fucking blew my mind. I don't want to butcher it, but the Medical Academy, there were guidelines created called the Flexor Report, okay? In 1909, okay? We're in 2025. This was created in 1909 and is still being used today. That is the guideline for how like medical schools and like practice guidelines are. It claims that holistic health is pseudoscience. Like, it literally says holistic health is fake. Fake science. Gosh. Yes, the Flexor Report. You can look this up. And that shit's crazy to me. And why is this still relevant? Why is this still being used? That should have been like updated, like decades ago.
That's so horrible that they said it's pseudoscience. Excuse me?
Yeah.
Wow.
I know. It's
That's
wild.
Crazy.
There's so many things to talk about and not enough time and not too many people talking about it. And
Mel, I really honestly, like, I'm talking to you like right now as a friend too. Like, I literally want you to read that book because it was really good. It was a little bit long or rambly, but it is really good.
Okay.
Or listen to the podcast. It was so good. I think you would love it.
She has a podcast?
She has a podcast actually, and you could listen to the audiobook. That's what I meant.
Okay.
She does have
Yes,
a podcast. Yes, she has a podcast. I know.
Yes, I will maybe get Spotify Premium for it. We'll see.
Wait, does Apple not have audiobooks?
You know what? I don't know. I've never looked.
You should look.
I've never looked. So
they probably
I'll
do
look.
if they're trying to compete with Spotify.
That's true. I would be surprised if they did it. Yeah. I'll have to look.
Okay.
But anyway, it's also just like the big discussion, the big thing in healthcare is like chronic diseases, metabolic dysfunction, hypertension, diabetes, type 2, Alzheimer's. All of these things are influenced by literally our lifestyle. And the healthcare system is actually, I think that they're trying to hide the fact that things are reversible, because I've had patients that are younger and have said that they're pre-diabetic or have diabetes, and they're young, okay? Like they're not over the age of 65. And to people before, I've literally said like, oh, has your medical doctor talked to you about like lifestyle modifications for diabetes? Like, do you know that it's reversible? I've legit said that verbatim to people. And 75% of the time, they say, no, they didn't know it was reversible. And type 2 diabetes is reversible. Like, you don't need medication if you don't need it. It can be managed through lifestyle change. But no one is educating us and telling us. Like in school, we literally don't learn shit about our health.
So I was going to say that, so diabetes is elevated blood sugar. But with diabetes, you have so many other things that when it's progressed, when you've had it for a long time, that happen. You get peripheral neuropathy. So basically you have reduced sensation in your feet. You're more likely to get wounds on your feet because you don't have good sensation. You have poor healing. Everything is affected. So if you catch it early on and you make those lifestyle changes, you are not going to get the side effects or the resulting things of diabetes. You have eye problems. You have diabetic retinopathy. So if you can reverse it early, that is good. But later on, if you already have the neuropathy, if you already have the eye problems, that's not reversible. So that's why you need to kind of catch it early on, because it also predisposes you to so many other issues with your blood vessels, blood pressure. All of these, and Casey talked about this too, is that a lot of these chronic diseases she thinks are related to diabetes.
100%.
So many people in our
That's
country,
a metabolic dysfunction.
It's a metabolic dysfunction, and it's just so crazy that, that you're right, that people don't know that you can reduce your blood sugar by literally making lifestyle changes, diet and exercise. Exercise is free. You can go outside, so that, like, you should be doing if you have diabetes. Like, everyone should be exercising. But you can go outside, go for a walk, get your 10,000 steps. It's really, that should be doable for everybody, I think.
And it's so funny you said 10,000 steps, because I actually looked this up because I was curious. Guess how many steps the average American gets
in a day?
Yes.
Like 2,000.
3,500.
No way.
Yes.
I don't believe that.
It says 3,000 to 4,000 if you look it up.
I get 5,000 and I'm on my feet 10 hours a day. So I don't believe that. I think most people probably get less.
That's fair. I agree with that. I think it's less. I think that the outliers are making that average higher than it is.
Yes, that's true.
But I think it's way less, especially because the majority of livable areas in America are not walkable.
No, they're not. It's not. That's true. It's not. It can be not safe to walk, or like it's
or just not access to walking. When I was in undergrad, actually, I took a public health class, and this really opened my eyes to communities and why I genuinely want to live in a city, because I want to have the ability to walk places, especially as I get older. But we think about public health, it's very general term. We don't really, I feel like if you're not in that world, you don't really know what it means. Like you think maybe vaccines. Like I feel like if you're listening, just what do you think right now of public health? But what we learned in this class was that literally anything can be public health and be a barrier or influencer to our health. One thing that is big is sidewalks. And in Florida, there are not sidewalks everywhere. In Indiana, there are not sidewalks everywhere. Like there's literally like main streets, side streets that don't have sidewalks. And it's like, why are we not having sidewalks and accessibility to walk and make everyone rely on a car?
Right. Because they want us to be more lazy and get fatter,
gas
and
money,
and
and contribute to everything.
Yes. But yeah, that's a really good point. There's always barriers. It's not always honestly accessible, and eating healthy too. There's a lot of places that are food deserts that for a lot of people, they have to drive 30 plus minutes just to get fresh fruits and vegetables, which is so sad. And there's people that can't afford it. Like I know I have a lot of patients right now that tell me that they can like barely afford their energy or barely afford, you know, the water bill, things like that. Like they just can't afford it. And of course they can't afford to buy healthy food. They're the ones that are purchasing ramen and just quick things that are microwavable that are basically, it's called, like she was calling it, dead food. It has no nutritional value. It's
literally
just going to basically keep you alive. Chemicals, highly ultra processed foods that cause more and more inflammation in your body. They cause you to actually, you basically get more and more hungry and more addicted to these foods.
Yes.
And you start to crave them more and more.
Fructose corn syrup.
Yes, the high fructose corn syrup. So we're basically constantly craving these foods that are not giving you any nutritional value and honestly just making you sicker and sicker. And that was a really big thing that she talked about in her book too.
Yeah. And like going off of that, like you can't dismiss the fact too that low socioeconomic status communities are affected the most. Black and brown communities are affected the most. Like minority groups are affected the most. So there's so many things that affect everyone's health, and like education, health literacy, like that's huge.
That was one thing I was going to tell you too. Like you talked about nutrition too.
Yes.
So a lot of insurances will cover meeting with a nutrition and getting that education, because there are ways that are still affordable and swaps that you can make. There's like rice can be really cheap. Beans can be really cheap. Beans are like 99 cents a can, and they are so high in fiber. They're really good for you. And it doesn't have to be like really, really expensive
like
food
TV dinners.
Exactly.
Do you remember the craze on like TV dinners?
Oh, yeah. Yeah.
Oh my gosh. I don't really hear about them anymore, but I remember growing up, like
I always wanted them.
TV. Honestly, same. But that was because the media and marketing for them was literally amazing. It was in like all shows, all commercials. Okay, I'm like an old soul, so I remember watching like the Brady Bunch and shit on MeTV. Most people will have no idea what the fuck I'm talking about. But they love talking about like TV dinners and like getting those little foldable tables and watching TV, drinking your Coke and having this like microwavable food.
Yeah.
I feel like I don't hear about them as much anymore, but I don't know if it's just because I'm not in that world anymore.
Well, that's another thing too, is like it's intuitive eating. And when you are sitting in front of the TV, and I try not to do this a ton, but sometimes you're just like so tired. You're like, I just want to put on a show
for sure
and like eat my food. Actually, it's not good to do that, because you are watching something and you're not connecting it with your food. You're sort of like gobbling up your food. You don't notice when you're full or, as much, because you're just like in front of the TV and you're distracted. And so it's not like practicing intuitive eating. Like you should sit down, eat your meal at the table, like focus on your food or the person in front of you. That was like definitely glamorized, where like the whole family basically has their little table, little foldable table. And I always wanted that. And now I'm like,
I know. Yeah, same. And now I'm like, I would literally never even go in that aisle in the grocery store because I don't even want to see it. Like, I don't even want it.
Yeah.
Don't even put it in my eyesight. Like,
okay, one that I would totally eat. I love Swedish meatballs with like gravy. So good.
I don't know if I know what you're talking about.
Oh, it's good. Have you been to IKEA?
they didn't have one in the city. So I never really, I've only been once in Ohio.
Okay.
So,
yeah. Well, in IKEA, they have like bomb ass Swedish meatballs, and I always crave them. And they're like pretty good frozen too. That's the only thing that I crave. And that's like, that's so good.
Yeah. But, I mean, win some, you lose some.
Yeah. And every once in a while is okay. But if you're constantly eating that like nutritionally dead food, I guess you could call it, that your body's not getting the nutrients it needs. And that's what's driving all these diseases and just supplying big pharma.
No, there was just so many facts and historical timelines that I learned from Casey that I thought were so important and like integral to like how our healthcare system works now. But when you're talking about ultra processed foods and like TV dinners and stuff like that, I didn't even think about this, but ultra processed foods dominated and skyrocketed with World War II. Oh, yeah. And that was not too long ago, honestly. And it was because of the war, because of needing to feed soldiers and have shelf life and prolong things. And then it skyrocketed. And then it just took off and it was cheap. So, of course, companies are going to want to continuously make things and find ways to cheapen their products to get more profit. Like from a business standpoint, it makes so much sense. But from a human standpoint, it's fucking us up.
I totally forgot about that. That's a good point. Yeah. It's crazy that they were doing that for war and then it's stuck.
Yeah. Yes. There's people out there that think a lot of these things are like conspiracies, but I don't know. I don't feel like I think that many conspiracies are wrong. So call me a conspiracy theorist if you want to.
Right. Yeah. I mean, there's definitely some that are out there, but this is for definitely like, I believe all of this. And this is like what we preach every single day. This is our life,
Yeah. But, that's like the goal of this podcast too, for like you, that's whoever is listening with us. Like this is the point, to talk about these things, to get it out there, to educate more people, to create conversations like this. Yeah. Because we need more of these conversations to actually make change in this world. And if one person even alters their lifestyle and is a little bit more educated than before on these like topics and things that we're talking about, like that makes so much of a difference, because then at that point it's also generational too. Like the habits you're building, you're going to pass down to kids if you have them, grandkids if you have them. So it's like not just affecting us, but it's literally affecting our like generational future.
Yeah 100%. I agree.
There's so many rants I can go on. I need to hold back for some.
Yeah, I was gonna say I would love to have her on the podcast one day, so we need to reach out to her, because that would be so interesting to hear her actual perspective.
Literally. And this is why rating us is so important, because we can grow and get big names on, like Casey means. But do you remember the part where they were talking about in the 80s? Okay, everyone and their mom freaking smoked cigarettes before. Yeah. And then there was the whole thing of cigarettes are bad in the 80s. And then turns out a lot of these cigarette companies were funding food companies. And you're just going from addiction of cigarettes to addiction of sugar and chemicals. And it's just like, it's so rooted in our system and normalized.
Yeah. No, it's wild. I forgot about that part. It's been a while since I listened to that podcast. It really opened my eyes up to a lot of things. We honestly highly recommend you guys listen to that episode too, because it was really good. And I'm not like a huge Joe Rogan listener, but I'll listen every now and then when he has somebody on. And it was actually my boyfriend that sent me the episode and sent it to me multiple times. And was like, you need to listen to this. Hippo. And honestly, every medical professional needs to listen to this.
Honestly, every human needs to listen to that.
Every human, period. Like every human needs to listen to this, because it was so eye-opening. And I feel like the more you learn, the more you kind of step back and you're like, this system is not what it should be.
Yeah. The more you hear the words pesticides, plastics, estrogen, ultra processed foods. Like, you will literally start to see the world so much differently. Metabolic syndrome, insulin resistance. Like, these are buzzwords, but they are so freaking relevant to our bodies and well-being.
Right.
And the more you hear them, the more you'll internalize it.
Yeah. So, as a physical therapist, we need to get patients past medical history. Yeah. And I will always ask, do you have any past medical history? People always say no. Some people will say, yeah, like I'll have, this and this. I had cancer before. And then I'll be like, well, what about, I always ask, high blood pressure, diabetes. And and a lot of people will be like, oh yeah, well that everyone has that.
Yeah. And they blow
I'm
it
like,
off.
excuse me? No, that not everybody has that. High blood pressure is not normal. Tith is tith. Diabetes, that's not normal. Okay.
No.
Not everybody should have diabetes. I don't have diabetes and you shouldn't have diabetes. So when they tell me that that's normal, it's just so crazy to me because I don't know where they're getting that information.
It's so normalized to them.
Yes.
And it's like, oh,
and
you
it's
have
not
this,
a big
let me
deal.
just give you this.
Exactly. It's not a big deal to them. They're like, oh yeah, they're like, I have high blood pressure, but I take medication for it, so now I don't. I'm like, no, you
That's
still
not how
had
that works.
hypertension, right? It's still, why do you have the hypertension? It's being controlled by medication, but what's the root cause? But patients don't understand, oh, I just take a medication for it, and that means I'm fine, I'm cured. No, that is not it.
Yes. Oh my gosh, I remember this. Much. Did your grandparents also do this? Or anyone, like, if you're listening, think about if your parents or grandparents did this. But my grandma used to say she didn't have diabetes, but she was taking medication for diabetes. Like,
you don't just grandma.
Like, is it a foreigner thing? Like,
wait, I have a funny story. My grandma has type 2 diabetes, and she's had it for years. Yes. She also has dementia now, which probably related because the microvasculature in the brain. But anyway, so she has diabetes. Related. And she loves a good piece of chocolate. She loves her a slice of cake. And so she grabbed a slice of cake and I'm like, Grandma. And I'm like, telling her the first slice, okay, like, Grandma, like, you shouldn't eat that. Then she goes for another one. It's always the ones with the freaking diabetes. She goes for another piece of cake. And I'm like, Grandma, you already had a piece. Let's stop there. And she snatches up the cake and she goes, oh my God, whatever. I'm on medication. And I'm just like, seriously, palm to the face. Like, how does your doctor not educate you that even if you're on medication and your blood sugar is quote unquote controlled, even though it's probably not, you need to make lifestyle changes. And when it's family, especially,
it's really hard.
You don't fight because they're not going to listen.
I know.
Tough, especially when it's family. And I'm just like, you know what, whatever. Whatever,
but just like comes back to like health literacy and education too. Like, I know my grandparents barely had an education. My grandma didn't even go past second grade, I'm pretty sure. And my grandpa went through high school and then electrical school to Greek military. And that was it. And I mean, especially for people coming to America, coming here for better lives and better healthcare and all of that, but then they don't have the tools to succeed.
That's a whole nother.
I know. I'm like, I just went into another realm. Maybe I should slowly creep it back because I can't go too far deep in that direction.
Yeah. Oh my gosh. Yeah. And we both come from immigrant families. Like, we're both first generation, and that's like a whole nother thing. Is first of all, not having resources, not even speaking the language, that's a whole nother barrier.
Whole other
thing. And access to healthcare. Yeah. But anyways, bringing it back in.
Yes, we'll reel it back.
The food industry, like we were talking about. Casey and Joe Rogan talked a lot about how we were talking about the high fructose corn syrup that tastes delicious. Anything that has high fructose, that's going to be delicious.
Addictive.
Yes, and it's going to be addicting and you're going to want more and more and more. And basically, the food industry is kind of contributing to, because the rates of obesity are so high right now. They really are.
The most they've ever been.
Yes.
Alzheimer's, highest prevalence it's ever been. Like,
Yes, it's
Everything is
all
at an all-time high.
connected. Yeah, and because it all causes inflammation in the body.
Yes.
Everything, Alzheimer's, high blood pressure, all of this causes like inflammation. It's caused by inflammation in the body, and all of our food is what's promoting this inflammation. The food industry is a big one, and that drives people to the pharmaceutical industry.
Yeah. And I also think like it's so hard to talk about these things sometimes too, because we'll say things like it causes inflammation too, but like if you're listening and you don't even know what that, like if you can't picture what inflammation to the body really means, that's also really hard to internalize, because it's like, okay, yeah, inflammation, but what really does inflammation mean? You know, like inflammation literally doesn't allow our cells on every single level, our nerves, our brain, our muscles, like every single connection in your body is literally lessened. Like its job is diminished. And that is why you have these mutations and these conditions and things that get through the cellular web, and like mitochondria, the powerhouses of the cells, like not doing their jobs. So it's so much more complicated than just inflammation, but that's just like a very generalized term for what's happening in the body on a cellular level that affects every part of our like body.
A lot of this is hard to digest, I think, even as a medical professional, even somebody who knows a lot. For me, it's not as much because I don't understand the wording or the terminology. It's just overwhelming to me. It's overwhelming because you feel like you're fighting this huge monster or monsters. And I'm just a girl. Like, I'm just girls. I'm just a baby. You know that video? Like, no, sometimes you just feel like that. But I just tell myself, honestly, if I can educate like one person a day and they could spread that to their family or their kids or their whoever, then I've at least done my part and I've tried my best. And I'm still learning. We're still learning. We're still trying to navigate all of this too. Yeah, I know this topic can be really overwhelming because you just feel like you're like, how much can I change and how much can I do? But really, it all starts with talking about this stuff. And I love that Casey brought this all up and talked about her journey and actually is trying to actively make change. Because what is a quote? It's like trying to make change with only talk is just like, I don't know. It's just nothing. You're not going to do anything.
I'm bad with quotes.
Yeah, I am too, and I totally probably butchered it. Basically, if you're just going to say something and not actually put any real force into it, like you need to walk the walk, not talk the talk. There we go. That's a quote that I know. But yeah, so
no, you're so right though. It's so overwhelming. Every day there's something new. Every day I feel like I learn some other piece of history or information that I'm like, fuck, now I need to think about this. Like there's so much going on right now and so much being brought to light. It's very overwhelming. So just reel it back into the basics and what you can control.
Yeah. And always try to learn more information.
Yeah. And honestly, and I'm glad that they talked about this too in the podcast, but sometimes I'm like, fuck the research, because some things just literally can't be researched. And does that mean it's not accurate? No, it just means that you literally can't control this variable and have a whole randomized double-blind control study.
Exactly. Yeah. Oh, that's like a whole nother thing. There's so many studies that haven't been done or that can't be done.
Literally can't.
Like we can't compare this drug versus eating a very clean, like healthy lifestyle or something like that. But we know it's just human nature to know that these foods are not good for us. And it's human nature to know that people should not be on 100 medications. It's human nature to know that we should eat fruits and vegetables, things that grow out of the soil, not that are like ultra processed. We don't need a shit ton of research to know that, you know?
Yeah. It's even like, if there is research that shows this, like, for example, this pesticide causes more estrogen and endocrine disruptors and all of these things to our system, but there's not an actual evidence-based research that shows it on a human, we can connect the dots, you know? Like we don't need a study with people that had the pesticide and didn't to know that it's bad for us.
Exactly. Research is great, but just because something is not backed by research, it also doesn't mean it's not true. So right. Yeah, that's like a whole thing, and that's how I feel. Period. That's how I feel. Right. Yeah, we're done. Yeah, we actually are almost done. Seriously, and this is actually also in PT, and I feel like in other medical professions too. To me, I say just because something is not backed by research or it's been disproven, I almost sometimes feel bad doing some sort of intervention because I know it's not backed by research anymore, or it's been debunked. But if a patient wants me to do it, if I think it might help just for this specific person, I'm going to freaking do it. And I don't care what research shows sometimes. Other times, I'll be like, pull out, research shows this. I like research, but
sorry, I'm not massaging your foot for plantar fasciitis. That's just not going to happen.
Exactly. Yes, there's certain times where I do pull out the research card, but certain times where I'm like, you know what? I don't care what the research says. Does this make you feel better? You specifically, you're a person. Research is a ton of people, and there's very specific, highly controlled variables like in the studies. A person does not necessarily connect or, I guess, apply to every single research study that's out there too. So that's just in general.
Totally agree with all of that. I feel like if I say more, I'm going to go into another wormhole. So
yeah. I agree.
Oh, okay. Well, I think we have yapped and gone into a bunch of different dimensions here. This is good episode and enough to be digestible at this point.
Yeah, that did not feel like an hour. That's crazy.
I know. It went by so quick, but you'll hear from us every Tuesday.
Prepare to get
All right. All right. Well, that is it for today's episode. Thank you guys for listening. We hope you enjoyed this conversation that sparked more just thought and conversations in your day-to-day life, internally or with others. We loved listening to everything Dr. Casey Means has, podcasts, audiobook, which I will listen to, and y'all should do it with me. Next week, we have our Break Room Talks episode where we just talk about random things, update you on life things, and whatever comes to mind, pretty much. So a little more fun and lighthearted, not as heavy of topics on the Break Room Talks. All right, we will see you guys next Tuesday. Bye.
Bye.